Good evening, everybody. Good evening, members. Good evening, council officers and those who have joined us online and members of the public watching online as well. Welcome to our Health and Adult Social Care Overview and Scrutiny Committee, the 5th of June 2023. If I can ask our Democratic Services Officer, Louise Smith, to go to through our housekeeping notices, please.
Thank you, Chair. Please note that this meeting of the Health and Adult Social Care Overview and Scrutiny Committee is being recorded by the Council for live broadcast and will be published on the Council website for a minimum of 6 months. The meeting may also be recorded or streamed for live or subsequent broadcast by members of the public, although ultimate discretion in this matter lies with the Chairman in case of disruption. For those in the room, please note that if a fire alarm sounds, please exit the building by way of the nearest available signed fire exit route and make your way to the assembly point in the car park outside the front of the annex. Finally, please ensure background noise is kept to a minimum and mobile phones and other devices are turned off or switched to silent for the duration of the meeting. For those in the room, this includes turning off microphones and turning the volume down completely on laptops. Thank you.
Thank you, Louise. There is a slight different running order with the agenda. But first of all, I'd like to ask if everyone could make their introductions because there are some new members here and we don't all know each other. So if I could start with perhaps Louise from our Democratic Services.
Hi, I'm Louise Smith and I'm the Democratic Services Officer that looks after the Health ONS Committee.
I'm Matt Gillett, Councillor for Tom Woods.
Phil Hornsby, Director of Commissioning for BCP Council.
Betty Button, Director of Adult Social Care BCP Council.
I'm Paul Slade, Councillor for the Creekmore Ward.
Councillor David Brown, I'm Councillor for Bearwood and Merley Ward. I'm not a member of the Health and Adult Social Care Review and Scrutiny Committee, but I'm the new Cabinet Member for Health and Wellbeing.
Hi, I'm Councillor Chris Matthews. I represent Campertip in Poole.
I'm Patrick Campbell. I'm a councillor for Boston West. Sorry, I'm Patrick Cadovan. I'm a councillor for Boston West.
I'm Sharon Carr-Brown. I'm a councillor for Queen's Park.
I'm Joe Salmon. I'm a councillor for Moordown.
Hazel Allen, Councillor for Bournemouth Central Ward. Sorry, I'm just trying to isolate a little bit. I do apologise being rude sitting over there.
Hi, I'm Louise Bay. I'm the manager at Health Watch Dorset. Nice to meet you.
Hi, I'm Dwayne Farr, Councillor for Kinston. Thank you.
Judy Richardson, East Southbourne and Tuckton.
And I'm Sam Crowe, Director of Public Health for BCP Council and Dorset Council.
Hello, I'm Councillor Jackie Edwards for Redhill and Northbourne.
Hello, I'm Lindsay Marshall. I'm the Overview and Scrutiny Specialist for BCP Council.
Thank you, everybody, and welcome. If I can ask Louise to confirm any apologies for this meeting.
Apologies have been received from Councillor Dedman.
Thank you. And do we have any substitute members?
No substitutes, Chair.
Okay, so then we'll go on to agenda item 3, which is the election of the chair for the Health and Adult Social Care Overview and Scrutiny Committee. Can I seek any nominations for this position? Thank you.
I'd like to nominate Patrick Canvan.
Are there any seconders?
I'd like to second Patrick.
Thank you. Are there any other nominations for chair? No. So I think, Patrick, you are now elected chair. Come up and take the hot seat.
Obviously, the first job as chairman is to work out how to work the technology, press the right button. Thank you very much. And my first job is to seek nominations for the election of vice chair.
I'd like to nominate Councillor Edwards.
Can I second that nomination?
Yeah. Thank you. Okay, any other nominations? Councillor Edwards.
Thank you.
Thank you. So, declarations of interest. Can I seek declarations of interest from members, please? Councillor Allen.
I have to declare that my husband is a non-executive director on the Integrated Care Board for the Dorset area, and I am a support worker to an autistic man who is in receipt of direct payments from BCP.
Councillor Salmon.
I work for Dorset Healthcare, member of Unison. Is that relevant? I think it is, yeah. I'm very new to all of this very formal meeting stuff. It feels very stuffy.
Thank you very much. Any other declarations of interest? Thank you very much for those. Confirmation of the minutes. So unless anyone indicates otherwise, I'm going to assume that the committee agrees to confirm the minutes of the meeting held on the 6th of March. Is that everybody happy with that? Certainly looking to those who are actually there. Thank you very much. Thank you. And the action sheet, can I take that as agreed also, unless anybody has any issues they want to raise on the action sheet? Everybody happy with that? Thank you. Are there any public issues?
There are no public issues, Chair.
Thank you. Then we move to item 8, which is the Health Watch Access to Primary Care and Project Plan, and an invitation to Louise Bates from Health Watch to present.
Thank you, Chair. Thank you for inviting me tonight. So I was just going to give a brief kind of bit of information about what Health Watch Dorset is for some of the new committee members, and then give an update on some of our work at the moment. So Health Watch is the local independent champion for health and social care. We listen to what local people have to say about health and social care services, and then we use that feedback to try and improve local services. And we also help people find information that they need about health and care services. So we're a tiny team. I'm the manager. There are 4 members of staff. There's Lucy, who's our engagement officer. Holly supports our volunteers. And Melissa takes all the phone calls and does all the inquiries. And then we have about 50, 60 volunteers across Dorset who help us do our work. So a tiny team with a big remit. So if we move on to the next slide. I'll let Louise pull that up. So how do we do our work? Well, we have a number of different ways of gathering feedback. So we do that via going out to events, running stands, promoting stands, that kind of thing. We have a website. We use social media quite a lot. And we have a phone line. And then we run kind of focus groups when we're working on projects. So we might run some specific events if we want to gather feedback about a particular topic. So last year, over 1,000 people shared their stories with us about their experience of care. And then we use all that feedback to design our work programme for this year. So the number one issue that people have been talking to us about consistently for about the last 4 years, actually, has been NHS dentistry, which I'm sure will come as no surprise to any of you when you probably hear from your constituents about it all the time. The other common issues that people raise with us are around access to GP services and around mental health support. And then we get a mixture of kind of quite complex kind of inquiries around social care, discharge from hospital, often people's experience isn't just about one service, it will be about a number of services and about probably the problems that occur in between services, the handover, I guess. So if we move on to the next one, Louise, thanks. Stuck. So each year we have a local board that help us do our work. So there are 8 volunteers who come together every couple of months and help support us so that we're focusing on local people, working the right way, making sure that we're achieving something really. And each year we look at all the feedback that we've gathered, everything people have told us throughout the year, and we look at the priorities that are going on locally, regionally and nationally. And then we pick kind of 3 or 4 work plan items, big projects for the year that we'll work on. This year we're working on dentistry because it's the #1 thing people talk to us about. The Integrated Care Board has taken over responsibility for commissioning NHS dentistry in Dorset. So it's quite a good time for us to have an influence on how that's delivered. So we're working on dentistry, we're working on urgent and emergency care. We've been visiting, Holly's been going out with some of our volunteers to visit all the minor injury units and A&E departments across Dorset over the last month or so, gathering feedback on how they're working. And I suppose the initial finding about it all is that the communication about the way they're all delivered isn't very clear for members of the public or for us trying to give information to people. So I think communication can be vastly improved as to where you go to get urgent care, but we'll be working with the system on improving that over the next few months. And we'll be publishing a report on our findings. And then we're going to be working on children and young people's mental health. So this has been a topic we've worked on for the last few years. We did a project called the Young Listeners a couple of years ago, which we trained and supported some young people to go out and talk to their peers and collect their stories about what services are like for young people. And this year, the NHS Dorset are working on a project to transform mental health services for children and young people. So we're inputting into that by going out and speaking to young people who might not usually have a strong voice in this. So our engagement officer has been talking to children who've been excluded from school, to young asylum seekers, a mixture of different communities across Dorset, just try and make sure that everybody's getting their say in this, in the development of services. If we move on to the next slide. So I'd encourage you all to sign up to our newsletter. If you have a look on our website, you can sign up and then we'll just send you an email once a month. It'll give you an update on the kind of things we're working on. And so you'll be able to see what we've been up to. If you want to get in touch, there's some ways in which we use social media. I was going to give you an update on access to primary care and the work that we did last year. So we'll be publishing our annual report in the next few weeks, actually, at the end of June. And that I'll make sure that I send copies out to all of you so that you can see a kind of summary of the work that we've been doing over the last year. Around access to primary care, I suppose our biggest kind of work really has been around dentistry. And then we did some work with GP surgeries, so building up relationships with patient groups at GP surgeries, and working with primary care networks, which are groups of GPs working together in an area. They delivered a project where it's called Enhanced Access Plans. So they were invited to deliver some extra kind of clinics for local people. And we did some work with the PCNs last year to make sure that GP surgeries were designing those services based around what their patients wanted and that they'd involved their patients in designing those new services. So that's the kind of thing we work on. Our focus is always on what are local people saying, what do they want, and helping them to have a stronger say. Did anybody have any questions?
Thanks, So it's just a point. Louise made reference to dentistry, and I've noticed on our forward plan that it is indeed coming up on the 25th of September. So I was just wondering whether it would be useful to sort of, if you're able to feed into that, Louise, as well, with the work that you've been doing on that and any sort of feedback that you've received from people, because I think it's clearly a massive issue, isn't it? So just a comment, really.
I think it would be really good. I suppose it's one of the ways in which it's really good for us to work together. So we're gathering insights all the time, constantly having people ring us about dentistry. I'm sure you're hearing for your constituents too. And together, all of that evidence makes a stronger kind of voice, doesn't it? So yeah, the more we can work together, the better. Thanks.
I'm going to ask if you would just introduce yourself, just for the purposes of members of the public who might be listening, just so that they know who you are. Joe.
Yep, so I'm Joe, councillor for Moordown. I found your lovely thing on dentistry actually, and it seems like you did some really good work contacting the dental practices that are listed available, and almost all of them come back and say they're not taking new NHS patients. So with the commissioning of dental services changing in April, do you have an idea of how we can use the commissioning of those services to somehow address that, so that next time, because actually when I moved back to Dorset like 5-6 years ago, nightmare getting a dentist, you're absolutely right. What needs to change to sort that out from your point of view?
I think dentists would tell you the national contract needs to change, and it's very difficult for us to have an influence on that. But health watchers across the country are working together with Health Watch England to lobby nationally for national changes that would support contract changes that would help people have better access. I think locally there's some funding that hasn't been spent that could be directed into making sure that particularly, I suppose, vulnerable people get to access dentistry. So we were looking at, you know, do children have access? During pregnancy you can have oral health issues, if you're getting cancer treatment, making sure that people who really need access, who are vulnerable, get the access that they require. But I think long term, yeah, it's national contract changes really. I think also we'd like to see a change in oral health education locally. I think there's more that could be done there to support people's access to information that would help.
Yeah, it's really helpful, Kat.
Thank you. Are there any other questions? Okay. Yeah. If not, thank you very much, Louise. Thank you for your presentation. Hope to see you again at some point. Anything we can do to help, please let us know. Okay, we're going to move on to item 9 on the agenda, which is the overview and scrutiny annual report. I'm going to invite Lindsay to take us through that, please.
Thank you, Chairman. I'm just going to bring up the presentation. Just bear with me 1 second. Yeah. Okay. Thank you for having me here. I'm Lindsay Marshall. I'm the Overview and Scrutiny Specialist. And I'm here to talk to you about overview and scrutiny in general as a function. Not restricted to the Health ONS Committee, but the entire function that operates within the Council. The Overview and Scrutiny Annual Report is looking back at the performance and the outputs from Overview and Scrutiny over the last 4 years, and is here to make recommendations for improvements to make sure that it remains fit for purpose. So that's what I'm going to cover with you. I'm going to take you through the purpose and the process around the ONS annual report, just to give you some familiarity, because I know that this will be new for most members. Give you an overview of the background and the activity and challenges that we faced in ONS during the 4-year period of the last council, 2019 to 2023. but I'd like to really focus in on the improvements and the key messages that are contained within our action plan for overview and scrutiny, and also drawing out the key messages from the statutory guidance for overview and scrutiny that we must have regard to as a council. So what is the annual report? It's a report of the Statutory Scrutiny Officer, which is me. I work within the Democratic Services team, but overview and scrutiny is supported by many officers throughout the council, including Democratic Services officers who work directly to support it, but of course all the other officers that come along and assist you in your work plans and preparing reports and giving evidence and information to you. The annual report is a constitutional requirement at BCP, and it's good practice to receive one, and it will be received by all the ONS committees and council. And the reason for this, it might seem like overkill taking it to all the committees and then council as well, and some of you will hear it multiple times, but it's important because there should be good council-wide ownership of overview and scrutiny. It is a councillor-led function. It's not driven by applications into the council or policy cabinet decisions. It's driven by your work plans that you choose and how you choose to do your scrutiny. And also fundamentally to scrutiny is the culture that underpins overview and scrutiny. So how do people operate within it? How do they communicate? How do you work together to select your work plan items so that they can actually add value to the work of the council and your residents? So in that respect, it's really important that there's good council-wide ownership, and not just from scrutiny councillors, but also executive councillors in terms of how they liaise with you to help you understand their priorities and how you can engage in them. So the report gives you an opportunity for reflection, and through that reflection, considering what improvements there may need to be, and especially at this time, we've got a newer council and an opportunity for a brand new approach, and to look at some elements that might need some tweaking to improve them. So a reminder of the statutory powers that you have in overview and scrutiny. This was touched upon in the training earlier, but they are quite unique powers that you have, and they're worth bearing in mind. You've got the powers to ask people to come to scrutiny, to bring you information. You can make recommendations and require responses. And the statutory guidance says the role that overview and scrutiny can play in holding an authority's decision makers to account makes it fundamentally important to the successful functioning of local democracy. Effective scrutiny helps secure the efficient delivery of public services and drives improvements within the authority itself. Conversely, poor scrutiny can be indicative of wider governance, leadership and service failure. So in that respect, scrutiny is a really important piece of the mechanics of local government decision making, and its unique role means that you can bring people together to find solutions where other council bodies cannot do that so easily. You can work in more flexible and diverse ways. You can bring lots of people around the table. You can seek evidence and test and challenge. And so the challenge for you is how you can maximise those powers to bring about the best outcomes. So if we refer to the report itself, I'm going to assume that you've read it, so I'm not going to go into it in huge detail, but just to give you an overview, the Appendix 1 gives you an overview of all the activity that has taken place across all the ONS committees over the last 4 years. And that allows you to look through and see what sort of work has been taking place and what has come of that work, and reflect on how you might like to channel your work going forward. And in terms of challenges, I think it's just worth touching on some of the challenges overview and scrutiny has come up against in the last few years. That's covered in paragraphs 10 to 18 of your report. There's been a huge volume of strategic decisions, as you would expect, with a new council being formed. And so overview and scrutiny had to keep pace with those decisions where it wanted to interact with them, and which led to high workloads. There was obviously a great amount of organisational design and transformation taking place in the council. And then, of course, everything was affected by the pandemic, including how overview and scrutiny meetings were run, which moved to online for a year, and work plans naturally shifted to focus on the pandemic and how that affected our residents. There has been a huge amount of political change in the council over the last 4 years, leading to changes in administration, committee membership and chairmanship. So in some cases that has led to the opportunity to try new approaches, bring in fresh ideas, but also of course that means that it can be harder to maintain a knowledge base and to bed in good practices in some cases. So a great deal of change over the last few years in that respect. And in 2021, with implementation in 2022, there was an ONS restructure. That is referring to the ONS committee structure. So where there were 2 committees and an overview and scrutiny board, the overview and scrutiny board was disbanded and replaced by 2 new ONS committees. So we now have 4 current overview and scrutiny committees. Some reflections on overview and scrutiny from external assessments. There was an LGA peer challenge in November 2021, and of health scrutiny. That said, health scrutiny is working well, and there are developing links with Dorset Council to join up across the ICS footprint. Partners engage well, and the committee's work on the pressures faced across the system, particularly in adult social care regarding hospital discharge and enabling people to remain at home as a strength. So that was really noticeable within that report, that particularly the partnership working that's been taking place here in Health ONS has been very effective. In contrast, it did pick up that political tensions continue to be played out in a way that is not always constructive and risks damaging the reputation of BCP. This risks distracting the council from its ability to unify and move forward in the best interests of the residents and councillors themselves. And it also said overview and scrutiny is not consistently adding value and needs to be reset to deliver on its purpose of ensuring that the council is open, transparent, accountable and delivers improved policy and services. So those reflections were taken in light of the whole function, but they are important ones to keep in mind. And in terms of how overview and scrutiny has been reset, some work has been done on that in terms of changing the committee structure. That's very small. I'm sorry, you might see it better on your screens in front of you, but this is the structure I referred to that was altered. And the aim there was to spread the workload more evenly across 4 committees rather than 3. But there's still more work to be done in terms of resetting culture, and that's something that I want to talk to you about today. I'm just going to move on to this slide. You hopefully will be familiar with this now from some of your training and induction sessions that have been running over the last month. The council just signed up to the Debate Not Hate campaign led by the LGA, and that is looking at eliminating toxicity of debate and improving the impact on democracy. So that's important to bear in mind for overview and scrutiny. And constructive challenge with respect is something that we can all bear in mind when conducting overview and scrutiny, and I think that will really help. I'm going to move on now to the action plan. That's at Appendix 2 to the report. The action plan has been formed for overview and scrutiny to gather up a year's worth of improvement actions into one place so that that can be monitored, and it has been generated by assessing our current status in all different practices across overview and scrutiny against the statutory guidance that the council must have regard to. That means that we have to follow it unless there's a good reason not to. So we have assessed what might need to happen to bring us up to the standard that is set out in the guidance, and that has formulated the action plan. If you look at paragraph 39 of the report, that will set out for you some of the priority areas for actions, including member and officer training, some of which you will have already attended over the last few weeks. Identification of a clear focus for ONS work communicated to the organisation. That's really important so that everybody understands what ONS is trying to achieve and what its priorities are. Annual work programming for ONS committees, strengthening the Cabinet and ONS relationship, developing working methods which make the most effective use of committee time, ONS function ownership by ONS chairs, so leading your teams in overview and scrutiny as chairman and vice chairs, role description for leading ONS positions, and the development of tools and protocols. There's much more in the action plan, but that's a list of priorities for us. Currently, all the actions are deliverable within the current resources, but I should put a caveat on that, that if meeting numbers for overview and scrutiny were to significantly increase, that will have an impact on the support that can be made available through the improvement actions for the function as a whole. There's a balance to be struck there. And how will the actions be monitored? Again, really small, I'm sorry about that. But the action plan will go to council along with the overview and scrutiny annual report this summer. And then following that, actions will be monitored quarterly by the chairs and vice chairs group of ONS. So the 4 chairmen and vice chairmen will have an important role to play in terms of monitoring the improvements across overview and scrutiny. And this will then feed into the next annual report, which will go through the following summer and be received by all the ONS committees again. So good opportunity for monitoring and ownership across the function. I want to go on to some key themes and important messages from the action plan and the guidance, but I just wondered, Chairman, having gone over the background and looking backwards, are there any questions at that stage?
Any questions at that point? Everybody seems to be happy.
Okay, thank you. So some of the key themes that I really wanted to draw out today, you should hopefully recognise from the training that you would have already attended. Number 1 is culture is the key to success. So culture is so important to scrutiny, and I'll go through what that means in a moment. Prioritising effectively for your work is essential, and adding value through your work. That is the overall point of what you're doing here. And so finding that particular area where you can add some value and make a difference to the work of the council and to your residents is what you're really aiming for. So on culture, the guidance says the prevailing organisational culture, behaviours and attitudes of an authority will largely determine whether its scrutiny function succeeds or fails. While everyone in an authority can play a role in creating an environment conducive to effective scrutiny, it is important that this is led and owned by members, given their role in setting and maintaining the culture of an authority. So I mentioned member ownership already to you, but it's about saying you set the tone, not officers. This is your function. What does culture mean for overview and scrutiny? It's about how you operate together, not the structure, as I already mentioned. It's a whole council responsibility, and it's about your expectations of each other. So what do you expect of your officers, and what can they expect of you in terms of clarity of requests? What do you expect of your executive members? How will you communicate with them? How will you keep up to speed with their priorities? How will you communicate with your partners? What sort of tone are you setting when your partners sit across the table from you in scrutiny meetings? Challenging with respect, we've already spoken about that, and relationship building and communication. So how will you communicate your role to the organisation? How will you keep up to speed? prioritising effectively. The guidance says that scrutiny members should accept that shortlisting can be difficult. Scrutiny committees have finite resources and deciding how these are best allocated is tough. They should understand that if work programming is robust and effective, there might well be issues that they want to look at, but nonetheless are not selected. That's a really tough one because there are many issues that you will want to put on your agenda, that your colleagues will ask to put on your agenda, your residents within your ward may raise issues with you. So prioritising and understanding where your priorities lie and understanding why you're going to say no to certain issues is difficult, but it should be difficult. So to make sure that you're adding value through your work plan. So in terms of prioritising, forward planning is very important. We are setting up forward planning workshops for all the overview and scrutiny committees between this first and second meeting, so that you can set an annual work plan for your committee. The benefit of doing that is, of course, that you're planning ahead. You can plan your scrutiny sessions with good lead in. You can think about who you want to have around the table, and you can scope your issues so that you can be making a difference. I should highlight at this stage that the good practice is to have 2 items per agenda, 2 substantive items. And when you think that you have 5 meetings in a year for overview and scrutiny, that doesn't leave an awful lot of room. So that brings into focus the need to prioritise really effectively. And you will, of course, want to leave space for arising issues through the year. So working in more diverse ways can assist with that. So if you're just gathering information, can you do that in another way? You want to really be reserving your committee time for getting around the table and making a difference and formulating outcomes with what you're looking at. Being realistic about resource, that's just another flag there around your resource. As I've mentioned, the number of committee meetings you have, but also the officer resource you have to support your priorities at a given time. Adding value through your work. The guidance says that effective scrutiny should have a defined impact on the ground, with the committee making recommendations that will make a tangible difference to the work of the authority. And a further insight for you: if scrutiny members are not fully prepared and able to ask relevant questions, the committee will not be able to fully interrogate an issue. And committee meetings can become little more than educational sessions for councillors to learn about a service rather than scrutinise it. So that's just really to focus on. This is a challenge for health and children's committees, is a lot of the information that will be coming at you. You need to have that information to be able to undertake informed scrutiny. So thinking about what you're trying to get out of the session, I think Sam touched on some of that earlier about what can your role be in terms of engaging with the ICS and the ICP, and what are you trying to get out of your scrutiny. So understanding some of your strategic aims before you go into scrutiny sessions will help you in really adding value through what you're doing. I just want to skip forward to one final slide. I think this is a really useful one. I pulled this out of the training that was delivered. So this shows that the impact of scrutiny on an issue declines as the decision becomes more imminent. So what that means is, if you're looking at a policy, whether it's a council policy or NHS service changes, if you're looking at it when the decision is imminent, only small amendments could be accommodated within that policy change. And clearly you're not going to be making a huge difference if you're engaging at that stage. So the more that you can plan your work to be landing in the second or even the first box and engaging in the development of policy, in understanding the direction of a policy and contributing views, or undertaking a particular role to help inform that policy, gathering some evidence of some form, you'll be able to contribute to the policy and make more difference in what you're doing there. So some overview and scrutiny committees will pick a topic, that they feel is a concern. They might have insight from their wards, and they will look at it entirely on their own. And then they'll formulate some policy and recommendations that will go into their offices and develop some policy. Or you could be looking at policies that have already been developed and they come further down the line to you. So clearly, as you go along that arrow, you're going to be making less impact. So I think that's just worth bearing in mind when you are looking at your work for the year. I'm going to stop there because I've spoken a lot to you, but if you've got any questions or comments.
Okay, questions, comments? Okay. The the forward plan is item 11 on the agenda, so we'll probably come back to that. But if there are no questions, I'm going to ask Councillor Brown if he'd be kind enough to give us the portfolio holders update.
Okay, thank you, Chair. Well, just actually in response to that last agenda item, the annual report, just say that your officer's quite right about there's been different approaches to overview and scrutiny over the last 4 years, and different there's been some issues with overview and scrutiny, but certainly I'm quite looking forward to attending these overview and scrutiny committees and being completely sort of open and transparent and listening to what members have got to say based on their sort of knowledge and experience, and taking that on board and taking on board the constructive challenge that you've got to make, particularly as far as I'm concerned, you know, when there's decisions coming forward within adult social care or the sort of health areas that I'll be responsible for. So I'm looking forward to sort of working with the committee and seeing how we go over the next few years. Just to give you a bit of an update, as mostly sort of new members that won't know me, just to introduce myself. I've been a councillor for 16 years now. I was on Poole Borough Council for 12 years, and then BCP obviously since 2019. Being a cabinet member isn't new to me. I was the portfolio holder for finance for BCP in 2019-20. So it's quite nice to return to a cabinet position. Health and wellbeing is a sort of new area to me. I've not worked in health and social care, but like most of us, I'm sure around the table, I have my own personal experiences of health and social care. I was actually a foster carer for 13 years for Poole Council and for Southampton City Council. Many times it was for teenagers who were approaching 18 and moving on to adult services, and through the sort of shared lives service that we've got here. And following on from that, I'm still power of attorney for one young man who went through the shared lives system with adult social care. And so I sort of still with him sort of experience the sort of adult social care side of things on a regular basis. And over the past few years, I've cared for my mother who had mobility problems and dementia, dealt with her home carers and social workers, etc., and hospitals and care homes around her until she passed away. And I've got many friends and family who work in health, social work, hospitals, care homes, or are carers. So I think I've got a lot of sort of knowledge and experience, both as a councillor and in my own sort of personal capacity around sort of the health and wellbeing agenda. You probably wouldn't expect me to have much to update on only 2 weeks into the role of being the portfolio holder for health and wellbeing. It's obviously quite a steep learning curve, especially in light of all the regulatory changes which have been mentioned to us and the whole integrated care system side of things. I've attended both the induction sessions over the last couple of weeks and had various sort of conversations and briefings with various people looking through the carers strategy, which was adopted in the last year, the extra care housing strategy. I've had a discussion with my Dorset Council counterpart, Jane Somper, as well, to make contact with her. This week, we've got the LGA peer review coming up, I think it was mentioned earlier, and I've got a meeting with the LGA panel on Wednesday coming up, so be preparing for that. And my diary is getting booked up with lots of board meetings, health and wellbeing board, safeguarding board, various different boards and committees that I'll be expected to be attending, so my diary is already getting full. And just next week, we've got the Cabinet all getting together for most of next week, actually looking at sort of strategy planning. So with the Corporate Management Board, so there'll be things coming out of that in terms of the health and social care agenda about what the Cabinet want to prioritise over the coming months and years. So that's about me and about what I've been doing. Just a few sort of brief updates. As I mentioned, the LGA peer review of adult social care is starting tomorrow, and there will be a paper on the findings being brought to overview and scrutiny once that's been received after that peer review. The adult social care review and transformational plans there's a business case being put together following adult social care review work around various areas that wish to transform and enhance over the coming months. Day opportunity strategy development is currently there's consultations on what the service delivery model should be. They'll be taking place through June, with the expectation that committee can receive a draft strategy in the early autumn before being considered by Cabinet. So I think that's probably an ideal thing for the forward plan, as we'll be coming on to, is to look at that, because if that's the strategy is being developed, the Cabinet will be considering. So I think I would appreciate it if Overview and Scrutiny Committee could have a detailed look at that and challenge what's in there. So implementation of the carers strategy is going on since that was approved. And so there's a lot of various areas around respite care, short-term breaks, support carers' physical, emotional, mental well-being, to enable them to continue their caring role, and care tech implementation as well. There's basically a sort of 5-year plan to mainstream care technology across adult social care and encourage practitioners to consider it as a first offer for a wider range of resident needs. So they're looking at the service design phase and aiming to have an operational model designed and benefits framework in place by September. So those are some of the things that are coming on over the coming months. So I hope that's of interest and use, but if anybody's got any questions for me, I'm happy to answer anything.
Thank you. Any questions? Okay, thank you very much. I'm going to move on to item 11, which is the forward plan. And as you can see from the agenda, we're being asked to consider and identify work priorities for its next meeting. It does say about a dedicated workshop. Could you give us an idea of that, when and?
Thank you, Chair. So just to give you an overview of this item for members who are newer to the Council, the forward plan item will appear on every agenda. It's a requirement that you establish your priorities and publish them with each agenda. So the ask in this report really is for you to confirm your priorities for the next meeting. Given that you are mainly new members sitting around the room, although there are 2 items already listed for the September meeting, that's in Appendix B to the report, and those items are access to GP practices and waiting times and dentistry provision. We're asking you to reconfirm that that is how you want to approach your September meeting. And also, as you said, Chairman, just to flag that we are planning to hold workshops for all of the committees so that you can look to your work plan for the whole year. And I'm hoping to be able to arrange those within the next month or so, but we will liaise with you around dates for that.
Would you be able to, just to confirm that that will take place before the 25th of September?
Yes, Chairman, the aim is to hold those before the summer recess, which is August, so right. Hoping for July.
Thanks, Chairman. Just for the 25th of September, as Councillor Brown's just mentioned, the day opportunity strategy should go forward to Cabinet in October. And that's the earliest opportunity we'll have to consider. It's been some ongoing work by committee over the last year and a bit. So there's been previous reports, but this will be the formulation of the strategy for adoption by Cabinet, should they so wish to. So I would suggest that might be a key one for September.
Okay. Yeah. Any other ideas, suggestions? Councillor Salmon.
Sorry, I'm probably going to ask a load of questions. questions because it's my first one of these meetings, and I feel a lot of them are going to be like going on a plane for the first time and going, God, it's stuffy, why don't we just open the window? So by all means, just go, this is a stupid idea. But looking at the forward plan, it seems like we straight away dive into quite a narrow focus of what we scrutinise. And correct me if I'm wrong, but the idea is we are a critical friend who looks at what the council is getting up to, specifically with reference to health and adult social care and all of that. And so in my mind, what we really want to do first of all is kind of have in our head what the canaries in the coal mine are. And so from the training session last time around, one of the things was the salt data set, I think it is, that goes off. But that's obviously really narrow. That is just that we're not going to have any idea looking at the salt data set if there are problems with dentistry provision and so forth. So in my mind, what we kind of want to get our hands on first as this committee is an overview of kind of what are those canaries in the coal mine. I like dashboards, you know, dashboards and data sets that we should be looking at constantly, not just the week before committee, but these are the indicators of problems, and that should almost inform what's on the agenda for the next one. And to my mind, I don't know what those indicators are yet, and it might be that everybody else in this room is like, oh, it's this, you know, but I'm just curious, is there a way we can take a more whole systems view of adult health and social care as done by the council? Sorry, I hope that makes sense.
Yeah. Okay.
Thank you, Chair. Just to give you a suggestion on that, I think that's an ideal way to conduct your scrutiny, is to be keeping an eye on data sets all the time. You shouldn't just be looking at them in committee once a year or every few months. The aim is to understand them and to be looking at them so that you can then understand where you need to direct your work. You can see, well, that area is okay, but we need to look at this. So obviously with input from the officers, it might be worth bringing something like that to a work planning workshop so that you can start to look at that there and do that assessment at that stage, and you can look at things in a much more wider way. This really, this report now is really just about saying to you, are there key priorities for September, in order that the officers can go ahead and be working on them in time for you.
Do we have to do that now? Is my question. Can we change those priorities?
You can change.
Yeah.
Obviously, the more you change, the less lead-in time there is to prepare.
Yeah, appreciate
the officers.
Yes, there is a suite of performance indicators that we have just reported on up to national government, which is a requirement to do on an annual basis. So that could give you that overview of adult social care, not of health, but adult social care. There are other health indicators that Kate Calvert's still online that we could also bring to the table, and I think Sam would like to come in, Chair, if that's all right, around other indicators.
Thank you, Chair. I think that's excellent idea around the data. And we are just producing client level data, which is really individual data, but we don't submit until July. That's a new thing that is coming out, and that is like the SALT data, which is short and long-term data for people that don't know what short or what SALT stands for. I guess looking at it from an overall perspective as well, some of the key things that Councillor Brown referred to might be one of the kind of indicators for members, which members might want to give some thought to at the workshop. For instance, you've heard a lot about the LGA review. They are going to look into the depth of adult social care. So from that review, we will have clear work that we will need to do. And that's a good, that might be a good area to kind of keep a close eye on as well. We also, Councillor Brown also touched on the adult social care review, transformational work that we're looking to do. That might be something as well. But data is key to all of this, both health and social care data and we can get some health data from our health colleagues, and we can get some joint data and some individual data that is specific to councils. But I would, there are some key things that are happening right now that you may want to put a focus on, if not in September, but maybe in the following months after September. Chair, thank you.
Thank you, that's very helpful. Thank you. Councillor.
Yes, also on perhaps a broader theme, and I'm wary that very possibly far too broad, and that's a learning curve. I am interested, and I think this probably will speak to the peer review as well. I think one of the main things that we do as a council, where we have our greatest interface between health and adult social care, is discharge from hospital and the care packages that we provide, and the prevention that we can offer in terms of stopping people going into hospital in the first place, and then ensuring that when they leave hospital, that they leave quickly and appropriately into a place that is safe for them to go. And we all know the problems around that. We understand that. We have sympathy with that. However, it seems to me almost the bread and butter of what we do to such a large extent. And I would be keen that we get into that. And I would just like to also say, in terms of the 25th of September, and I don't mean this in any way disrespectfully, but I'm always nervous when I see that the agenda item just says to receive an update. Whether it's, that just terrifies me. That's death by committee, and I really don't want to do that, please.
So thank you.
Thank you very much. I was just going to come back to the point about information and indicators and remind committee that the Integrated Care Board is a public meeting, and every meeting that they hold in public, they will be producing a performance pack. So if you need a quick way into the current performance issues around some of the big health pathways, that's a very easy way, and I suggest that we take some of that into the workshop.
Thank you. It would be good to try and get like a permanent link into it, wouldn't it, to try and keep on top of that information. Sorry, Councillor.
Sorry, I'm incredibly ignorant. What's the workshop that's coming up? Just because I'm so disorganised, I haven't got my wife with me. She manages my diary. Is this something that is already sat in there that I know about, or something that I've forgotten?
Helped you out with his marital problems.
Not in my job description, but yeah, the workshop is not a date that you will have already received, so don't worry. We are aiming to set up workshops for the 4 Overview and Scrutiny Committees so that you can really have this sort of discussion there and get into the depths of what you want to look at and why. So it's great to see some ideas coming forward now, and that's what we want. But that's the place that we can do that work. So we will communicate with you and make sure we find a date that works. And I just wanted to add, in terms of the data that we've been discussing, there is a councillor hub on SharePoint that you've all been invited to, which is currently being populated with your training that you have attended, so that you can look back over that. But we are working on that and developing it currently. So what we'll do is set up committee pages. So as you establish information that you want to receive on a regular basis, it can be populated in there, and you can look over that on your own terms and have your own discussions outside of meetings to understand where you want to direct your work plan. So just so that you're aware of that resource.
Thank you. That's going to be really helpful, I think. Okay, can we move on from that to item 12, dates of the future meetings? So we've got those dates that have been set out for the next 4 meetings, all with a 6 p.m. start. Is that correct? Yeah. Okay. Any points on any of that? Okay. Well, if nothing else, I'm going to close the meeting. Thank you very much indeed for your help.